Hey there, and welcome. Today, we're going to get a grip on something that can make even the simplest tasks feel like a huge challenge: thumb arthritis. It's incredibly common, but that doesn't mean you just have to put up with the pain. So we're going to break down exactly what it is, and more importantly, what you can actually do about it.
Does this sound familiar? You go to open a jar, turn a key in your door, or even just pinch something to pick it up, and boom, there's that sharp, frustrating pain right at the base of your thumb. If you're sitting there nodding your head right now, trust me, you are in the right place.
And there's a very real reason why this pain feels so disruptive. It's not just in your head. Our thumbs are responsible for a whopping 40% of our hand's entire function. 40%! So yeah, when your thumb hurts, it pretty much feels like everything becomes 10 times harder.
All right, so here's our game plan. First, we're going to figure out what thumb arthritis actually is, the anatomy of the ache, if you will. Then we'll tackle that big question, why me, by looking at causes and risks. After that, we'll dive into all the non-surgical ways to find relief, talk about when surgery might come into the picture, and finally wrap it all up with your path to managing this thing.
So let's start at the beginning. What in the world is actually going on inside your hand that's causing all this trouble? Let's get right to the bottom of it.
The specific condition we're talking about is called osteoarthritis. You can think of it as the wear and tear type of arthritis. That smooth, slick cartilage that caps the ends of your bones, well, over time, it starts to wear down. The analogy of tread on a tire is just perfect. As it gets thinner, you lose that cushion, and eventually, it can become bone on bone.
And the problem is centered right here, at the base of the thumb, in a joint called the carpometacarpal joint. We'll just call it the CMC joint. Now, its unique saddle shape is what makes our thumbs so incredible. It's why we can pinch, grip, and have such amazing dexterity. But that cool design, that wide range of motion, also makes it a little more susceptible to wear and tear over the years.
So how do you know if this is what you're dealing with? The symptoms are pretty distinct. Of course, there's that pain when you grip or pinch something, but you might also notice some swelling or feel tenderness right at the joint. Sometimes there's even a grinding or clipping sensation. The technical term for that is crepitus. And as it progresses, you might lose some strength and motion and even develop a little bony bump that gives the base of your thumb a kind of squared-off appearance.
And all of this leads to that really big question, right? Why me? Was it something I did? Is it just random bad luck? Well, let's take a look at the factors that can actually increase your risk.
Okay, this is one of the most striking things about thumb arthritis, the huge difference between men and women. For reasons we're still figuring out, women are way more likely to develop it. Some studies suggest it could be as much as 20 to 25 times more likely. The main theory has to do with ligaments, which are often a bit more flexible in women, and that might lead to a less stable joint over a lifetime.
Now, beyond gender, a few other key things come into play. Age is a big one. The risk definitely goes up after 40. Your genes can play a part too, especially if you just naturally have looser joints. If you've ever had a bad injury to your thumb, like a fracture or a serious sprain, that can unfortunately set the stage for arthritis down the road. And finally, think about your job or hobbies. Anything that puts a lot of repetitive stress on that thumb joint can speed up the wear and tear process.
All right, so you think you might have it. What can you actually do? Here's the good news. There is a lot you can do. Managing this condition almost always begins with simple, non-surgical approaches that can make a massive difference.
And the most fundamental idea here is simple, but it's so powerful. It's really about modifying how you use your hands. As the experts at Shirley Ryan Ability Lab put it, just learning to avoid excessive force or repetitive pinching can make a huge difference in the long run. It's about working smarter, not harder, with your hands.
Splints are another fantastic tool in the toolbox. But here's the thing, it's a bit of a trade-off. A hard, rigid splint is amazing for giving the joint maximum support and letting it just rest and calm down. But you can't really move your thumb. On the other hand, a soft, flexible splint lets you keep doing your daily tasks while still giving you some helpful support. The best one for you really just depends on what you need most: rest or function.
And for those times when the pain really flares up, some simple medications can be a big help. You've got your oral anti-inflammatories like ibuprofen for quick relief. Topical gels are also a great choice because you put them right on the spot so you get fewer side effects throughout your body. Some people also find relief with the anti-inflammatory properties of supplements like turmeric, and there are even prescription creams made from the stuff in chili peppers. It's called capsaicin.
Two other heavy hitters in the non-surgical world are hand therapy and injections. A good hand therapist is worth their weight in gold. They can teach you specific exercises to strengthen and stabilize the joint and show you all sorts of tricks to protect it. And for really stubborn pain, a corticosteroid injection, a cortisone shot, delivers powerful medicine right into the joint, often giving you relief that lasts for months.
Okay, so what happens if you've tried all these things, you've given it your all, and the pain is still really getting in the way of your life? Well, that's when it might be time to start a conversation about surgery. But it's really important to see this as the final step in the process, not the first.
And I really want to stress this point. Surgery is not inevitable. It's not. The truth is, the vast majority of people with thumb arthritis are able to manage their symptoms really well with all those non-surgical options we just talked about. They never end up needing an operation.
But for those who do need it, there are a few different surgical paths. The most common one is called a trapeziectomy, where a surgeon simply removes a tiny bone at the base of the thumb to create space. Another option is a fusion, which basically locks the joint in place. You lose some motion, but you gain a lot of strength and stability. There's also joint replacement, kind of like a tiny hip or knee replacement, and even a procedure that just cuts the tiny nerve endings so your brain doesn't get the pain signal anymore. And here's some really good news. Even the world of surgery is getting better and better. According to Dr. David Rutsch at Duke Health, some of the newer, less invasive techniques have been an absolute game changer. They've managed to slash the typical recovery time basically in half, from more than 6 months down to around 3. That's a huge deal.
Okay, we've covered a ton of ground. So let's bring it all home and really focus on the key things to remember as you figure out your own best path for managing this.
First, just know that this is super common, especially for women. You are absolutely not alone in this. Second, and this is huge, non-surgical options are incredibly effective for most people, so always start there. Third, please remember that surgery is a last resort, not a first step. And finally, and maybe most importantly, talk to a professional. A hand therapist or a hand surgeon can give you a proper diagnosis and help you create a plan that is tailored specifically for you.
So, we'll leave you with this to think about. Based on everything we've talked about today, what's one small, simple change you could make in your daily routine, starting right now, to help protect your thumbs for all your tomorrows? Thanks so much for joining us for this explainer.